American senior communities have developed a very helpful checklist to help patients realize the very best results post-surgery. Robin Rosebrook is here from North Park Nursing and Rehab, and she has that list for us, and it's really kind of key. I think you said pilots use checklists, shoppers use checklists, so why not a post-surgery checklist?
Exactly. You know, a lot of folks think, okay, I'm preparing pre-surgery, but we got to think about the post-surgery side. So you want to make sure you're prepared for, after you have that surgery, what do I do now? You know, it's time for you to recover. So you got to think about, okay, how am I going to do my rehab? Is there going to be any financial pieces to that? Your nutrition is important after surgery, as well as making sure you know what medications you're taking and what you need to stop taking depending on your doctor's orders. But then also think logistically, you know, how am I going to get my groceries? How am I going to get my prescriptions filled? Depending on your situation, it may be a little bit difficult, so you need to prepare in advance.
That's just really kind of asking yourself those leading open-end questions. What do I need? Because not everybody's going to need those things. So how do you determine what's going to be best for you, especially if you've never had surgery? You know, a lot of people manage to go through their whole lives and then have surgery very late in life, and so they don't know what the experience is like.
Correct, yeah. So that's what the American Senior Communities Checklist is for. It's for post-surgery, so it's going to initially say, okay, let's think of a rehab facility. So getting out there, visiting places that offer inpatient and outpatient therapy services, taking a tour, visiting, making sure that they have the services that are going to meet your needs. But then also thinking about, okay, what's the financial piece? You know, is there going to be a copay, or am I going to have any out-of-pocket costs? But then also thinking about, okay, I've got all that checked off, so now how am I going to get my means to get around for medications? Want to make sure that you know what medications you're taking prior and what medications are going to be post-op. But then also knowing, okay, for the nutrition, I need to make sure I'm having meals. Do I have to have meals ordered? Am I going to have family to assist with that? Because sometimes certain surgeries require you to be in a rehab facility, or you're, you know, bedbound for a few days or very slow moving. So you want to make sure you have those means. And then if you have pets, people don't think about that, but who's going to feed my pets when I'm in the hospital? And also just kind of looking at, you know, making sure I have means to get around to doctor's appointments.
Well, it's things that we do in our daily lives. We don't really think about it until we're under the gun to get some decisions made. So let's talk about the rehab services that you provide.
Okay. American Senior Communities, all of our facilities provide physical, occupational, and speech therapy.
And what is the difference between physical and occupational?
Okay. Physical therapy is a lot of your physical parts. So we're going to work on mobility, your balance. And then occupational therapy is going to do anything that occupies your time. So looking at your ADLs is what we call it, your self-care, so your bathing, your dressing. We're also going to address financial management. That's a lot of what folks have to do when they go home. But also looking at cooking. Can you cook safely? Looking at being able to care for your home, making your bed, sweeping, mopping, anything that you may need to do when you discharge. And then those services can be provided in any type of setting, whether it be an inpatient rehab or an outpatient service.
And what determines when, let's say you've been in one of your facilities and you've done your rehab and it's time to go home, what determines when you get those in-home services?
What determines those in-home services is when your therapy has been completed in a facility, so you've kind of reached your maximum potential. At that point, then we do a home assessment, and we go out with you as part of your therapy to the home environment and see how you function, how you get around. We're not worried about if it's cluttered or if it's dusty. We're going to recommend things, so we want to make sure you have clear pathways to get around. Making sure that you can maneuver in the bathroom and the bedroom is very important. And then that next step would be referring to a home health service to discharge you home. To
take you all the way to wellness.
Yep.
Thank you so much for all this great
You're
information.
welcome.
Happy holidays.
Thanks, you too.
And we'll be back with more lifestyles, but let's check in with Ron Rhodes.